Let's discuss the Chinese medical theory, the holistic concept. Advocates of TCM approach readily acknowledge the overwhelming superiority of Western science and modern medicine in unraveling the microbiological mechanism by which disease affects physiological processes, as well as the drugs that destroy hostile pathogens and rectify cellular disorders. The TCM approach is to look at underlying conditions, the imbalances, that allow the pathogens to take hold or the cellular disorder to arise. TCM could be deemed as looking at the health of the human body holistically from above, while Western medicine looks at it from below, at the level of cells, genes, and microbiological agents. This is, of course, not a fair characterization of Western medical principles, which also encourage looking at the patient's body as a whole rather than just his or her blood tests and x-rays. But the reality is that Western medicine has been spoiled by great advances in diagnostic technology. So doctors tend to rely more on laboratory tests than on observing of symptoms presented by the patient on examination. The role of the family physician or the general practitioner has also declined relative to that of the specialist. TCM has only direct visual and tactile observations and the patient's description of how he feels on which he relies. To rely, hence being holistic, is its own only choice. Chinese diagnosis relies on directly observable symptoms presented by the patient, including the patient's own detailed description of how he feels, then proceed to draw conclusions on how the body's condition has deviated from that of a healthy and balanced state. Therapy consists of bringing the body back to the balanced state, like the umbilicus wooden wheel cart pulled by a bullock in ancient China. Chinese medicine is a technologically primitive. Like the bullock cart, it is crude and slow, but sometimes gets the job done. Occasionally, perhaps it even takes you through dirt tracks and hilly terrain that the BMW cannot handle. Chinese medicine invented relatively simple models of the human body and of disease causation. It has applied these models in complicated ways to handle a wide variety of illness using experience that physicians gained over its long history. That many people were healed when these methods were applied should not be in doubt. What can legitimately be asked is whether they were healed by the methods applied. Would the same number have been healed anyway if nothing had been done? Close to 100% of common colds healed with no medical treatments. Even if the answer to this question is no, meaning that there are some patients who are healed by Chinese medicine who would not have been healed if nothing had been done, it can still legitimately be asked if the therapeutic gain was caused by something specific to the TCM treatment rather than by a placebo effect. Hence, there is ultimately a need to put TCM therapeutic methods to the test through clinical trials. Reconstructing TCM theory. Attitudes towards TCM are virtually polarized into two camps, the believers and non-believers. Most TCM practitioners belong to the first camp. Most Western doctors belong to the second group, although typically, while rejecting TCM theory, some observe that TCM interventions may produce therapeutic results, a point conceded even by one of the alternative medicine's sternest critics. Many Western doctors now also believe in and practice acupuncture as a method of pain relief without necessarily accepting TCM theory's explanation for its efficacy. For example, the Singapore Health Ministry recognizes a one-year part-time course to qualify Western doctors for the practice of acupuncture in their clinical work. These doctors learn to needle various acupoints for symptomatic relief of conditions such as pain, dizziness, and insomnia. Few of them believe that ancient Chinese theories that attempt to explain the therapeutic mechanism of acupuncture. TCM faces legitimate challenges by Western science on two counts. First, many of its core concepts like chi meridians and phlegm sound like meaningless or, at any rate, metaphysical entities, ill-defined and mostly not measurable and even unobservable. Second, the model used in TSM theory are mostly untested. It has also not been generally made clear that they are testable. Thank you for your attention.